Hello, and welcome to the latest episode of Kristen's Corner, a podcast by your state senator, Kristen Phillips-Hill. And thank you for tuning in. We continue our special series of podcasts regarding the coronavirus, and we continue to talk to individuals who are on the ground, on the front lines in various industries. We've spoken with experts and leaders in healthcare, our local economy, and our law enforcement. And today, we are pleased to talk about higher education. Today, it's great to be joined by York College President, Dr. Pamela Gunter-Smith. And Dr. Gunter-Smith, welcome to the podcast.
Thank you so much, Senator, for inviting me. I'm happy to have an opportunity to have been included among those individuals that have an opportunity to speak in this forum.
Wow.
So thanks for having me.
Thrilled to have you. And for our listeners, I do want to point out that this podcast recording is over Zoom, so we are adhering to CDC guidelines and practicing social distancing. So, Dr. Gunter-Smith, although I understand your students at the college, they call you Dr. GS.
That's correct, and feel free to do that.
I will do that. As someone who has a lot of initials as well, I understand. Well, Dr. GS, you are in a very unique position as president of your college with a very special background. Could you tell our listeners a little bit about your personal background that provides you with more knowledge than most of us on this pandemic?
Happy to. So I actually started my professional life as a research scientist. Since the age of 5, I always wanted to be a bench scientist, have my own laboratory, and work in that area. And I actually did that pretty much until full-time, until I went back into higher education. My doctorate is in the field of physiology, which is the basis of medical practice. And I spent a great deal of time teaching medical students, nursing students, and conducting my own research in the field of gastrointestinal physiology. That's a mouthful. But because of that, and because of my teaching responsibilities and my interests, I have a broad background in various areas in the sciences, especially in those that are related to the medical field. In another lifetime, I was the U.S. representative to NATO on gastrointestinal physiology, and that was some time ago, again, before I went into higher education administration. Pertinent, I think, to COVID-19, I've always had an interest in pandemics and plagues, those types of things. And I got interested in that because one of the first ones that I studied was a diarrheal disease that actually was one that I studied when I was a research scientist. And in my days when I was teaching, I actually developed a course that started with one of the best known one that was inured in the 1300s called the Black Death was one of them that probably people know about. Then talked about the cholera epidemic that was in, like I would say, the 1800s, H1N1, all up to this time. And the name of the course was Public Enemy Number 1, Pathogens and Disease. And I used it as a platform to talk about viruses, bacteria, epidemiology, but also about how these pandemics ultimately had an effect on life and culture. And I think that when we think about COVID-19, when we move out of this period of infection and looking at deaths and mortality, we will be forever changed. And it will look as one of those times of having a major effect of the way in which we live in our culture. So, I've had a little bit of experience in terms of studying it and teaching it, but I am by no means an expert in the area.
Well, I mean, that's incredibly fascinating. And I think that it shows how your insight puts you you are particularly well suited during these very unprecedented times. And I think you're right. Our world will be changed forever. Some people believe we're going to flip that switch and we're going to be right back there taking up March 6th, right where we left off. And I think we know innately, and certainly with your background and knowledge, things are going to change. I'm not sure exactly how, but things will definitely change.
Yes, absolutely.
So, can you walk me through the decision of York College of Pennsylvania when you decided to close your physical campus to classes? You were one of those first colleges that made the decision, and also what you did with students studying abroad. And I say that because even though I'm a state senator elected to make decisions in Harrisburg, I heard from so many people who were impacted by having children or loved ones in various places overseas. So just talk about the decisions to close campus and what you did to take care of all those students and folks that you had overseas.
One of the things about this type of event, and I will couch it in terms of natural disasters and things that we experience. And I think a lot about what happened during Katrina. We saw that event coming. We could start to prepare for it. It happened, it ended, and then we were on the road to recovery. This is very, very different in that we didn't necessarily see it coming or to know how it was going to affect us. And it's this whole thing about uncertainty. If we knew that it had an end, then we would take care of it and we would be able to move on into what I'm calling the stage of recovery. For us, our spring break is very early. It's actually early in like the first week in March, the end of February. And so we already had students who were abroad for the week studying. We also had some students at the time who were in Italy, in Milan, on an exchange program. And so around the 1st of March, as things started to deteriorate in Italy, and in particular in Milan, before they closed it down, we made the decision to call our students home. We contacted them. Some of them were reluctant to come home. We bought their tickets. Ultimately, we contacted their parents to help convince them to come home, because regardless as to what happened, even if it wasn't going to be a full outbreak, we were very concerned about transportation and would we have an opportunity at a later date to get them home. So we called those students home. And then followed the CDC guidelines for that area and had them to quarantine for 14 days at home off campus. We had another group of students who were in Spain, but that at that time was not a hot spot. They were to come home in a couple of days. They returned, but it was not necessary for them to be quarantined at the time, but our health services followed them very, very closely. It became apparent to me, and I went through the H1N1 season back when I was in New Jersey, which was a very different disease. The mortality associated with it was very different. It was contagious, but not as contagious, so you could kind of manage that. But I started thinking about what would happen here on our campus if I had an outbreak of COVID-19 here, and how I would isolate and care for our students. I also thought about, when you think about that we have 4,000 students and 2,000 some odd of them live on campus, if they all got sick, how would that overwhelm the healthcare center here in York? So once I realized that given the nature of our institution, We value face-to-face contact. It's a very close community. You're dealing with, on campus, 18 to 22 years old. They are like to congregate and be together. And even if I ask them to self-quarantine, the likelihood of being able to enforce it would be very difficult. I made the decision to go ahead and close campus, and made that decision, I would say earlier than most other institutions, because because of the timing of our spring break. There were even things to consider, such as not only how we care for them, our own health care center here on campus, but how do you feed them? So for example, our dining hall is a wonderful facility, but it's a communal eating facility. How do you serve them? How do you keep the students from congregating together? That's what young people do. So with respect to thinking about that, I made the decision that the best thing to do was to close our campus and to send our students home. We had, at one time, after that first week, about 200 students who were left on campus. They were doing clinicals over at the hospital with WellSpan or elsewhere. As I would say about 3 days later, we made the decision to pull them out of those clinicals and also to send them home. So our campus is closed, and it is not only closed, it is secure, in that we're not allowing individuals to walk on campus and what have you, for security reasons. But that's how I made that decision. It was the what if, and how would we manage it? And I knew that it would be very difficult for us to do that. And I had a limited time in which I could make that decision and be able to get them home.
As a mother of a fourth-year student at Drexel University in Philadelphia, I had that conversation with my son, and everything you said just rings so true to me as a parent of a college student. And, I said, you need to come home. And, but why, So, and they made their decision much later than you made your decision. And, I think when we're younger, we're invincible and we don't think there'd be problems. And, I began to explain, well, looking at how things are going other places, and depending on what measures get put into place, you're in a city. They don't grow their own food there. Food has to come in. Food supply chains can be disrupted. All of those things that you account, public transportation, all those things Absolutely. That you need to get around will be shut down. When you come home and you're here in, rural, suburban York County, a lot of those things are taken care of in different ways. You really need to come home. So, what was their feedback like? So you moved forward very quickly before a lot of other schools did. Right. What was their response? And I guess, hindsight is always 20/20. What was that initial response? But what are you hearing from students now?
Well, I would say there are a couple of things, and I just want to emphasize about the way residential colleges are arranged. Residential colleges are for really a place of socialization, networking, people coming together. It is very difficult for us to do things otherwise. When you think about typical residence halls, things are shared. Even if you come to our dining hall, students serve themselves. And so there were just some subtle things we put into place. Initially, I would say that we did it in stages. And so the first thing that I did was to do it for 2 weeks to see if that would be enough time to get a sense of what's going forward. So we originally were supposed to return on March 30th. And as that date slipped away, then we said, okay, we'll come back April 15th. And then the week before that, I decided that we would have to close for the rest of the semester. Students expected to come back. And so many of them didn't, well, why are we leaving? I don't want to leave. I don't want to go home. What about my studies? How am I going to finish my internship? What's going to happen with my clinicals? And so I would say the response was, again, that sense of uncertainty. What does this mean in terms of my ability to complete my studies? What will happen? But that first closure was not that big of a deal for them. Okay, so we're going to go away, and then, a week later, you'll have online classes, and then we'll come back and life will be normal. I think that when it was clear that we were closing for the rest of the semester, students expressed this feeling of loss of the coming together that is so much a part of what we call our Spartan family. They miss having those interactions with one another. This may sound minor, but it really isn't for those student athletes who were looking forward to competing in their final year and having their senior days and their senior nights. That didn't happen. The students who were looking forward to having their families on campus and that big white tent come up for graduation, that didn't happen. And so students are, I would say, being very cooperative as we now go to the online format. But what I hear from them is, please let us come back. Please let us know when we can return. I miss, being there and being there with my friends. And that just speaks to that small type of intimate campus. So that's what I've heard, more so than complaints about anything. That and when will we be able to return to get our stuff, of course. But, it's that sense of loss, I would say, as a community that I'm hearing from most of them at this point in time.
So at this point, the new normal for students at York College is that they are taking their coursework online.
Right. I would say we were in a better position to move to the online format than other small schools that don't have an online program. We actually started our first 100% online program this year, which is an RN to BSN program. So we had already geared up to have the ability to teach online. 2 years ago, we started having some summer school classes online. And so a lot of the technology and the training of our faculty in terms of being able to teach online, we had already started to do that. So we started on teaching online, I think it was March 16th, going completely online. Our faculty, we saw this coming and we planned for the fact that we may have to be virtual. So 2 weeks, even before we closed our campus, we started gearing up to help our faculty to understand how to do that. So all of our classes are online. For some of our lab classes, even some of our clinicals, our faculty are doing simulations online with our students. I did a guest appearance on a Zoom class meeting about 3 weeks ago. The students were all very much engaged. Our faculty have really stepped up to the plate in terms of being committed and offering our courses online. But, it's more than just instruction that's important to us. So our student activities group here on campus because you don't just go to class all day, has set up a number of virtual events for students in the evenings, virtual trivia games, esports, a hypnotist. I don't know how that works, but trying to do what we can to provide as close as we can to the experience. Our tutors are still working. Our disability services are still intact. Our faculty are advising students remotely. And so even though it's not the same experience, we have worked very, very hard to continue to provide those things that are essential and a hallmark of a York College education, even if it can't be face-to-face.
Well, I had a really wonderful time. I was able to be one of the judges, the J.D. Brown Center for Entrepreneurship, the Tech Accelerator, the Ben Franklin Partners. They all came together, and it was like Shark Tank. Young entrepreneurs who've been working at York College with all those entities made their pitches, and it was fantastic. The winner was this collaboration between a York College student and a Johns Hopkins student. They had known each other in high school, and I'm really excited to see how they take their product and move it forward. So I know that there really are some great things that are continuing to go on. Although, I too miss that ability to connect with people. I understand how those students feel. So after this pandemic is over, and I know it's going to be over at some point, what lessons do you think higher education has learned in this process?
I think about that quite a bit. And again, we started preparing for this early. My crisis management team, we actually still have a Zoom meeting every morning. We will continue to do that, and we had already started to meet. I think that we will have to think about and to really think clearly about how we deliver our educational experience for our students, and what is important and perhaps what is not as important. We're going to have to really pay attention to the way in which students learn, the way in which some things you can do virtually and some things you can't do virtually. But I think that it is going, for all of us that view higher education also as a business enterprise, because it is. We have to generate revenue, we have expenses that, higher education was already struggling before this happened, with the decline in the number of high school graduates going to college. That is in particular the case here in Pennsylvania. There has been a marked decline in that. And so the competition was already very keen for students. But I think it's going to help us to understand how fragile the business model is for all of us. We talk a lot about the cost and about it being too expensive. Well, there are reasons for those expenses. But in many respects, we're going to just understand how fragile our educational system is and how we're going to have to make changes in order to address that. I think about York College, founded in 1787. I mean, isn't that a tremendous legacy? What we've been through here at the institution, how we have served, and what I and here as president, I have to make sure that the institution is going to be here for the next 100 years, and what it is that we have to do now to ensure that that happens. Again, we had already started to expand into online learning, to start to serve an adult population. We like to think of ourselves as always being able to evolve. So we had started on that path, but I think that this is going to move us to think about how we have to yet to evolve in some other ways in terms of how we deliver our programs and our value proposition. We have a knowledge park that will be coming on. And, you certainly Senator, have been a champion of that for us. Thank you so much. But that's really going to change, I think, the dynamic once again between the community and York College that will serve both the community and the college well going into the future. So I think in many respects, this has been a wake-up call about how we're going to have to think about higher education's business model in terms of moving forward. And that's a challenge for us as well.
Well, you certainly have an incredible legacy of educating York Countyans for their future success. And I think that with every great challenge comes a great opportunity. And I'm excited about the Knowledge Park and the future of York College and what it means to our community.
Right.
And speaking of what York College means to our community, the college has been on the front lines of providing personal protective equipment, or PPE, as we all are now very well aware of those initials, to our local health networks. So tell us a little bit about how that all evolved and the contributions you've been able to make to our healthcare community.
So because we have a clinical program, of course, in nursing and what have you, and training our students in that field, we have been able to supply some of the things that we have to the local healthcare agencies, and that includes both hospitals here, that includes nursing facilities, and that goes from N95 masks to gloves. We even had a ventilator that we were able to give to one of the hospitals here to use. UMPC requested that, and we had one that we use for teaching purposes, so we were able to do that. Our catering service here on campus also has gloves and masks, and have been donating them around. And we stand on call to do anything that needs to be done to help us during this crisis period, especially as our healthcare system should get overwhelmed, which we hope that it doesn't. But we've talked about how they might be able to use some of our facilities if necessary. So we remain in close contact with them. But the other thing I will say that I'm very, very proud of is not just the immediate, but a lot of the people who are on the front lines of this in York County are our graduates. We have a long standing history of graduates in health fields, in nursing, all the way from RNs to nurse anesthetists, to folks to respiratory therapists, nuclear medicine. And so all of those graduates are the people who are on the front lines. Most of them stay here in York County. And so we're just very, very proud that in addition to the immediate contributions that we have been able to contribute to that, and will continue to do that with our new graduates coming out.
Well, that's just another part of a tremendous legacy that York College has in this community.
Yeah.
It's really amazing to see all these different entities coming together and helping folks on the front lines to care for people in the community.
Mm-hmm.
It's very gratifying. So, Dr. GS, any final thoughts to your students, to your alumni, parents, prospective students on York College, the community, for when we get out of this pandemic?
So for the past, it seems like this has been a year, although it's only been a couple of months. I look in terms of preparing in stages. So I talked about the immediate things we needed to do, which was really for health and safety. The short term, dealing with our classes. Now we're trying to, it appears we've just announced that we're not going to be able to do our summer classes face to face. They will be virtual. We're trying to figure out how we're going to manage, hopefully in July. But now I'm starting to think about the culture shift. And by that culture shift, what it means for our institution. How is that going to change a residential college? We've had to make some tough decisions that I hope are temporary, given the fact that we don't have students here on campus and people whose jobs really are focused on that with them being here on campus and being served. And so that's as I move into what I'm going to now talk about longer term and the recovery phase. I really have to think carefully about what that means for the future of the institution and how we're going to move forward from this. I am, let's just say I am really grateful that our students want to come back and that they miss that face-to-face interaction. You can get an online education in many different ways from many institutions, but there's only one York College in the way in which you can do that. So I'm looking now forward to what that means for us and how it's going to change. And I know that there's some things that we're doing now that we perhaps will not be doing or will be doing in different ways. And so, I think for everyone that hears this, there are a couple of things I think points to make. One is that we are a member of this community. We have served Yorktownians, as you say, for over 235 years. We will be here. We will continue that mission, and we will continue to evolve with the times as they need to evolve.
I will tell you that one of my colleagues early on said that the comeback will be greater than the setback. And I think you've just confirmed that for us again. So I want to thank everyone again for joining us. And that concludes another episode of Kristen's Corner with your State Senator, Kristen Phillips-Hill. Today's guest was Dr. Pamela Gunter-Smith, who is the president of York College of Pennsylvania. And for any additional information on today's podcast, please visit my website at senatorkristen.com. This is State Senator Kristen Phillips-Hill, and we will talk to you again soon.